Welcome to It's a Grand Life. Did you know that in the United States alone, 2.4 million kids are being raised by their grandparents or other family members other than mom or dad? 2.4 million. It's a Grand Life is a podcast for those grandparents and kinship caregivers who are committed to making a difference for those kids. Grand families are in every neighborhood, every city, tribe, and territory nationwide. If this is you or someone you love, this podcast is for you. Our goal is to offer hope and resources to help you. Please subscribe to our YouTube channel or follow us wherever you get your audio podcasts and leave a review. Every new subscriber and review helps us reach others that need assistance. Welcome to another episode of It's a Grand Life. Hello, my name is Craig Nash, and I'd like to welcome you to another It's a Grand Life. And you are going to be so blessed today. I don't know about you, but in our house, every night we have a battle with our granddaughter getting her to brush her teeth. So we've got two experts on the show today, Doctors Marcy and Craig Goldin from the Dentistry Institute in Troy, Michigan. And they're going to tackle the tough questions about how to get these grandkids to be concerned about their oral health. But before we get into that, doctors, thank you so much for joining us today. And we want to hear a little bit about your background, how you got into dentistry and specifically cosmetic dentistry. Then I've got a lot of questions about how it would really benefit our listeners to take a deeper look at their oral health. But thanks so much for joining us today.
It's our pleasure. And we got into, actually, Marcy was into dentistry. Dr. Marcy Goldin was into dentistry well before me. And by the way, if you hear a little yelping back there, our dog won't shut up. She wants to be part of this action, and we're not letting her. So how did you get into dentistry?
My father was a dentist. He was the first graduating dentist after World War II, got his GI Bill from fighting in World War II, helping to liberate Italy, and ended up, that's how he was fortunate enough to go to dental school, graduate from the University of Michigan, as did I. And I started working in his office when I was 11 years old. So I've been doing it for a long time. And my uncle was a dentist, his brother-in-law, and I married a dentist. So there's a lot of dental stuff in this family.
We went to University of Michigan School of Dentistry.
Outstanding.
Yes, and we met there the night before dental school was starting, and we were putting away our instruments, and I was hopeless. And I saw this pretty lady a few seats down the row, and she saw pity on me to help me put my instruments away back in. So I like to say it was love at first bite. So we met, went to dental school. We got married between our third and fourth years of dental school, and we're going on almost 40 years.
Fantastic. That's a great story. And what a legacy of oral health, right? Going back to World War II. Mm-hmm. But so, and our listeners, we're older, we're grandparents raising our grandkids. And so we need to look at oral health from two vantage points. Number one is what do we need to do as grandparents to take care of our teeth at this age? And maybe you could share some success stories later in our show. And then how do we get our kids excited about oral hygiene? But so what should dental hygiene look like for grandparents? I know this is something that goes on for our whole lives, right? Yes. I remember being at a dental office where the dentist said, you only need to floss the teeth you want to keep, but how do you get...
I'll use that line.
I love that line. But what should it look like for our grandparents, that as far as what's regular dental hygiene look like? And then how do you get the patients then talk about the patients that you've done such great work with over the years? And
is it okay, Craig, if I can mention a few things before we get into the oral hygiene part?
Yeah.
There's a lot of things that happen, particularly as we grow older.
Right.
And so it's not necessarily business as usual in terms of how we used to take care of things. It's not uncommon for us as we age to get periodontal disease. That's one of the most common diseases known to man. And with that, unfortunately, comes bone loss. The bone around the teeth is lost, and then the gums recede, often leaving exposed root surfaces of our teeth. So I want to talk about this before the oral hygiene,
Okay.
because those root surfaces are not as hard as the white part of our tooth, that white covering of our tooth enamel. And so they're much more susceptible to decay. Often patients have sensitivity to temperature changes and maybe spicy foods, or even when they have their teeth cleaned, it's a little sensitive there. So it's not business as usual. And we really have to also, many of the medicines that we're put on as we become older, suddenly that may cause drying mouth. And the mouth drying can leave a situation where we're much more susceptible to getting cavities on the root surfaces of our teeth. Would you like to talk about the oral hygiene part? And anything else you want to add?
No, you did good.
Well, how about the oral hygiene?
Well, one thing I think that will hit both the grandchildren and the older patient. As we get older, we get arthritis. Our hands don't work as well as they did. And sometimes it's hard to hold on to a toothbrush. And when I first started in this business, we used to take a bicycle handle and put the toothbrush inside of that so it would be better to hold on to. But truth be told, we've been in this business for a long time. There's things called the Oral-B toothbrush and the ultrasonic, the sonic toothbrush, Sonicare. And they have made brushing teeth for young and old such a game changer. You want clean teeth? Use one of these toothbrushes. You can't have trouble holding on to it. You're not going to have trouble holding on to it. They're a small investment and really worth the investment. For kids that don't have the manual dexterity yet to brush their teeth, this also helps.
Yeah.
And when should they start brushing their teeth, doctors? What's the earliest?
Well, when they're first born, but as soon as they start getting teeth, 6 months, 8 months, we actually lay them on the floor with their head in our lap, and we do a little brushing with no toothpaste. We're cleaning their teeth. And this goes on until they're older. And for me, our kids would say, I can do it myself. And I'd say, okay, brush your teeth yourself. And then when you're done, I'll do it. So we both get to. And that goes on for a while till.
Do you want to touch on how old they should be when they go to the dentist? First visit to the dentist.
Well, the books say 2 years old. I think there's not much you can do with a 2-year-old. I think they're called the terrible twos for a reason. And you can't reason with a 2-year-old. And unless you look in their mouth and you see black spots that might be cavities, you actually see a reason and you're concerned about something, I think you can stretch it just a little bit, because the difference between a 2-year-old and a 3-year-old. Now remember, pediatricians and everyone says too, I'm just saying if you can stretch it and their mouth is clean and it looks good and you don't see any issues, you can play with a 3-year-old in the chair. You can make the toothbrush go magically on, and 2-year-olds don't know what magic is. It works.
You can bribe them with a prize.
Bribing works. Bribing doesn't work with a 2-year-old. Yes.
So we're really waiting for cooperation.
Yes.
Right? The child to be old enough to cooperate. We want it to be a really positive experience. We want to create great dental patients for life, a fun place to go when they go to the dentist.
Right.
We don't want to create a negative situation where the child is afraid to go to the dentist.
So those first couple of visits have to be smooth as silk, right? They have to be almost like going to Cedar Point in a way.
Actually, they just have to be successful.
Right.
So if you have a situation where this is not going well, if you can pick the kid up, put him in the chair, and just tell the dentist to make the chair go up and the chair go down, boom, you've aced your first appointment. Then reschedule it a couple weeks later.
And it's not uncommon for us to have When the child's 2.5, they could come in with grandma or come in with grandpa and get a ride in grandma's lap, up and down
Right.
in the chair, earn their first prize. We're trying to set them up for success.
But not during grandma's appointment. That's no,
Right.
seriously.
Right.
It's not a good idea.
No.
No.
Have you had that happen where grandma's bringing in the grandchild and it's hard to get into grandma's appointment when the grandchild's sitting there?
Yeah.
Well, yes, and the
Yep.
noises and there's
Yep.
sounds and there's smell. It's just not a good idea.
We're
No.
just
Make it
talking
just
about
be all about the child.
right, an in and out appointment, end of grandma's appointment, bring the kid in and up and down in the chair and win a prize.
I know you have a family dentistry practice, but you really specialize in the cosmetic dentistry. And so tell us a little bit about patients with missing or broken teeth. How do you address that?
Missing and broken teeth is so common, especially as we age, because our teeth, we're living so much longer than our ancestors did.
Right.
Maybe our teeth were meant to go 30, 40 years, if that, and we're hoping that they're going 80, 90 years, maybe 100 years. So it's not uncommon for even wonderful dental patients over the years. They've had problems, they got their tooth fixed,
Right.
then the tooth breaks off and now they got another problem. It's not uncommon for this to happen as we get older. And so we do dental implants for our patients. It's there's a lot of different options. There's false removable partial dentures, but we find our patients really want something like they had before. And
Right.
that's replacing a missing tooth or a failing tooth with a dental implant. And we replace anything from one tooth to a whole mouth of teeth
Wow.
with dental implants. You want to add something about that?
Yes. So, people think because we get older, we don't care about our looks, and we do.
Right.
And so there's simple things you can do. Let's say you have all your teeth, but they've had 55, 60 years of coffee drinking and tea drinking.
Right.
Well, the nicest, easiest, quickest, most affordable way to give you back 10 years is to whiten your smile.
Right.
So in-office bleaching is a very safe way to do that. So that's number one. Number two, we think that I don't have money to save all my teeth, so I'm just going to save the ones in front. But when you think about it, we have a saying, you had a saying with your dentist, just floss the ones you want. We have a saying that if you want to save your front teeth, the way to save your front teeth is to save the back teeth. Because you
Okay.
do 300 pounds of worth of chewing on those back teeth, and the front teeth weren't made to do them. Each has a job. So it's really important to listen to your dentist when they have a suggestion, and they should be able to give you 2 or 3 suggestions on how you can replace what's missing. And by replacing that, you save the front ones.
Right. And you mentioned about the cosmetic aspect of our practice.
Right.
I want to dive into that for a second, Craig.
Sure.
Dr. Goldin and I, we have always had a passion for helping our patients have a nicer smile. We oftentimes we take this for granted. If you've got nice teeth, you have a nice smile, you don't
Right.
think about it. But it's embarrassing for many patients to have crooked teeth, stained teeth, discolored teeth, chipped teeth.
Right.
And it's embarrassing. And these patients, it affects their life. You'll see people, they're embarrassed to smile, so they never show their teeth. They smile
Right.
and look at you like this. They don't want to show their tooth. They're talking to somebody, they're having their hand in front of their mouth.
Right.
It's embarrassing for some patients. And society unfortunately judges us by how we look often, and that
Right.
includes our smile. Because what's the first thing we notice in a patient, about a person? It's their smile.
100%.
We want to see
Yeah.
them, and if they're smiling, they look happy and approachable. If they're not smiling, we're thinking maybe they're not approachable. So we have a passion for this. We want, whether it's one tooth to match its neighbors or a whole mouthful of teeth. And sometimes we do what's called full mouth rehabilitation, where
Wow.
We're fixing every tooth in the mouth to give them a healthier smile. And at the same time, our philosophy is, it doesn't cost you a dime more. We ought to fix all these back teeth anyway. It doesn't cost you a dime more to have them look great,
Right.
have them look nice, and have you feel proud about and excited about your smile. And increase your self-esteem.
It'd be a game changer.
I wanted to go talk about the cosmetic aspect you asked me about.
Yeah. And so absolutely. And I know you showed me some before and after pictures earlier, and I think that would be just so critical for our audience to see, what are you talking about when you're talking about cosmetic dentistry? Because some of those pictures look pretty challenging for someone who's a non-dentist like myself.
Oh, for sure. Would you like me to share them now, Craig?
Absolutely. That would be great.
I'm going to share the screen.
Okay.
Hopefully I don't mess this up. I'm a
Oh,
better dentist than an IT guy. So I want to share with you, this is one of our patients that came to me. She has a mouthful of crowns.
Okay.
You can see there's different colors on every single tooth that's there. And she has been doing everything her dentist told her to do over the years. You broke a tooth, you get a new crown. You have a crown, let's do it. You got a cavity under a crown, you need a new crown. And this went on for years and years. She was a wonderful, wonderful patient. And at one point, her dentist said to her, I'm sorry, you've got a lot of root surfaces exposed. You got cavities underneath all those crowns, even though they kind of look good, you got problems. So the dentist said, you need dentures. And she said, no way. I am not going to have a denture. I'm not having a denture.
Right.
I want to have a nice smile. And I want to be able, I have friends that have dentures, and half of them don't wear it, and half of them can't eat things that they used to be able to eat. And I'm not doing that. So she came to us. She met our team. My team, we love changing lives. This is so gratifying for us both as a dentist and my entire team, because we know we are making a difference in somebody's life.
100%.
She came, and we did take out all the bad teeth, but we replaced many of those teeth with teeth. They were hopeless teeth. They were not salvageable, and we replaced. We gave her some dental implants and new implant bridges, and we call our bridges Esteem dental implant bridges, because we want to give our patients their self-esteem back. So this is her before, and there's her after, where we replaced her upper and lower teeth. We placed dental implants, and we gave her Esteem dental implants. This was done. She got teeth within a day and a half. Got her teeth, and it's totally comfortable. The patient comes in, we wrap them in a warm blanket. We do some IV sedation so they have little or no memory of the experience. We do what we need to do, and patient gets new, beautiful teeth. So this is her upper and lower was done, and here's her before. Look what the change occurred. I mean, she look a little bit more youthful, more dynamic, more excited.
Her smile is bigger. She looks great.
So allowed us to fix her bite and to give her a smile that she was proud of, and she'll never get another cavity. That's what's nice about this. I mentioned that often some of the medicines we're on dry our mouths. We get cavities on the root surfaces of our teeth. She'll never get another cavity because dental implants don't get cavities. Here's another patient. This gentleman came in, and he could afford dentistry. He was taking care of things. He had a lot of going on in his life, and he was breaking his teeth and had problems, and it wasn't like he wasn't a regular to the dentist, but things kept breaking off. He's like, what am I going to do? So he essentially had hopeless teeth or failing teeth, and we did dental implants for him as well. This is his before, and that was his after.
Wow.
Yeah, and here's this. Look at this. Same guy.
Man.
We want to enhance lives here. That's what we're all about. So we love our job. That's what's so nice about doing the type of dentistry we do. Now, we don't only do dental implants. Somebody needs dental work. They need a new crown. We're going to help them get a new crown.
Okay.
If they have problems with their bite, or so many dental teeth need work, but they want to keep their own teeth, our goal is always to help our patients keep their own teeth. But when they get to a point where it's not worth saving, or it's not a good idea to save them, it's time for dental implants. What do you want to add?
Nothing.
We
We
have,
let the dog in because she was barking, and now
Oh,
she's crying, she's
yeah.
moaning.
She wants us
So
to.
it's not us, it's
Yeah.
the dog.
So I'm going to de-share this. Let's see. Close the share. Stop
You know,
the share.
Dr. Golden, what was so unique about that first patient is for a layperson like myself, patient didn't look terrible, you know,
No.
so it's all underneath the surface, right?
Yes.
You're all those issues that you see as dentists that we lay people are clueless about was really creating a mouth that was unsustainable. And that's why with that whole new smile she's got a new lease on life. And are those were those some of your younger patients? Are those some of your older patients that you've worked with? And there's no age limit to
No.
getting a new smile, is there?
No, we've done that procedure on patients who I've done that procedure. The oldest patient I've had is in his 80s. He still wanted a quality of life.
Right.
You know, imagine not being able to eat the things that, because you're worried you're going to break a tooth, not being able to eat the things you enjoy. Suddenly your diet's changing. So, or maybe you've got dentures and they're loose and they're falling out, and your friends ask you, hey, let's go to lunch. And you're like, no, I got to let the dog out. And it's not that you have to let the dog out. It's that you are embarrassed to be seen with, with your false teeth.
Right.
And so, we kind of think dentures are a thing of the past. And if patients who have dentures, we can help them as well. So, we can let them get their lives back. It is so, life changing. Suddenly, and a patient will come in and they'll say, I want to get, my daughter's getting married. I want to have a nicer smile for the wedding. And or my granddaughter's got her sweet 16, and everybody's going to be in town, and I'm embarrassed, and there's going to be a lot of pictures, and suddenly we're doing this beautiful smiles, and they're like, I've got a beautiful smile. I know I wanted this because I was embarrassed by my smile, but I forgot the things that I couldn't eat, and now I'm enjoying it, and I can eat anything I want. And I'm not worried that I'm going to cause a problem, or I'm going to get something stuck under my partial denture, or something's going to hurt me. It is so life-changing. We're honored to be part of it. Our team goes crazy. They love helping our patients doing this as well. So you can tell, I think we're pretty excited about it.
You are, and so there's a definite difference between dentures and implants. Right. And you're talking about a huge difference in quality of life, right?
Yes.
I mean, and you see all these advertisements for cleaning the dentures on TV and what have you, and how simple they've made it. But if you can't bite into an apple, or or chew a steak, you've got a real problem.
Right. Yeah. There's a multi-billion-dollar industry on denture products, especially denture adhesives or denture glues to help hold them into your mouth, because they just don't stay in. It's not like your own teeth.
Well, imagine the very muscles that are supposed to hold the denture in are the very muscles that are pushing the denture out of your mouth. So your tongue is flipping it out, and your lips are flipping it out. And so you're trying to do a balance act, holding everything in while you're trying to chew and speak at the same time. These people should be given a medal. It's a very, very difficult, not everyone can accomplish. And with an implant retained denture or an implant retained bridge, this is screwed in. It's not going anywhere. So, the joke about the grandma blows out her 100 birthday candles and their denture comes with it. There's little memes of that. And
right.
That doesn't happen. It just doesn't happen. And then I have one thing I wanted to add to what my husband was saying. He worked on an 80-year-old. Well, he worked on another 80-year-old. Oh, no. He worked on a 90-year-old. That was my father.
Okay. The worst thing was he's a dentist.
So my father and my mother lived in Florida for many years. And he always complained that he just never found a dentist that he liked as much as us. And we obviously, the three of us worked together, and he got to the point where his dentistry became old and it needed replacing. So he had several teeth that could no longer just be fixed with another patch. He needed crowns. And he said, for me to lay in a chair for 2 hours for each crown, I can't do it. I can't physically lay in the chair. So we brought him up to visit with us, and we made couple appointments in the office, and we did some sedation dentistry, and he had all his crowns done.
Wow.
Anything he needed. And he was saying, oh, this is the only way to go. This is the best thing ever. And it was wonderful. And then he came back and we gave all the temporary crowns. We gave him the permanent crowns, and he was thrilled that he was able to do this. He didn't have to worry about it. And it was a gift for him. And he just went around saying he was like this reborn dentist. He was like, this is the only way to have your dentistry done. I'll sleep.
That makes so much sense, because we're all impatient. Just sitting in the chair for 2 hours at any age would be a challenge. But
Right.
if you can be sedated, that just makes so much sense.
Right.
So I just absolutely love what you guys are sharing here today. So when I was going to ask you about the difference between the implants and the dentures and the bridges, but the clear way to go is the implants, if you can do it, right? And do you replace bridges, and you do dentures and bridges all the time, I would imagine, right?
Yeah, we do. We don't do a lot of dentures or partial dentures
Right.
Anymore, because we've been doing implants for so long. It's really the gold standard today, as opposed to removable teeth. Those removable teeth just they're nothing compared to having something strong and solid, which is a dental implant. And dental implants have changed the way we do dentistry, because the success rate for a dental implant is somewhere around 97, 98% success rate. That's higher than almost anything else we have going in dentistry. So it's really a great option for whether it's a single tooth that we need to replace or a whole mouthful of teeth.
That's just so great, and I'm just so glad you joined us today and shared all that your knowledge on this cosmetic dentistry. It just makes so much sense, and it's so clear. I tried to put together a couple of questions, not knowing which way this could go, but with the improvement in dental implants, it makes so much sense. And for our grand families, that's one thing you don't have to worry about if you get your teeth fixed, and it's going to absolutely improve your self-image and self-esteem and everything else. And what's the best way to get in contact with the Cosmetic Dentistry Institute? What's the best way to get in touch with you folks? I imagine you do consultations with new patients and what have you.
The best way to get in contact with us is to call our office. The number is 248 519 1919. And it's 248 519 1919. We should schedule a new patient exam and x-ray appointment so we can see what's going on. And then we can start figuring out, what do you need? How can we help? What are all your options? How much each option is going to cost? How long each option is going to take?
Right.
Then our patients can make intelligent choices when we present them with those options. So contact us. The best way is by phone. And you're not going to get a recording. You're going to get a human being that's going to answer, hopefully within 2 or 3 rings.
That's great.
And because that's what we do in our office.
Right.
And Dr. Goldin, what about second opinions? Are you called in a lot for second opinions? Folks are wanting to redo their whole mouth. I just want to talk to another dentist to make sure I'm on the right path. Do you do that as well?
Yes, we do that as well. We do that as well. We love doing second opinions. We're here to answer any questions that our patients have, so that they can, whether they end up at our office or they continue with their first opinion that they went to, no problem. We're here our job is to help our patients so that they can feel confident that they're making the right choices, whether it's in our office or with another office. And we'd be honored to have your guest of this podcast call us. And
that sounds
schedules. We all, when we do the dental implants, we often, if it's somebody that needs just dental implants and not comprehensive exam, we'll offer a free complimentary implant consultation. That includes, that's about a $500 value. It includes a free dental CT scan or dental CAT scan, so we can see if their bone quality is adequate, so that they can get dental implants. And we would be happy to offer that to your guest as well. If somebody's interested in just I just want to have some information, and maybe they want to do a free. We also offer a free virtual smile consultation, and you need to shoot us a couple of pictures, ask us some questions, and we can do a free consultation. And there's a link to that right on our website. And I know that the information is going by. It's thedesignersmile.com. We have a page on there where the patient can upload a photograph, and we can do a complimentary smile consultation or smile analysis to give them some information. And that's a starting point. Then we usually, okay, next step is call our office and let's see you for an exam and figure it all out.
You make it sound so simple. That's so great. And I know our producers got your information at the bottom of our screen. So just want to encourage all of our local audience to give you folks a call and start to take control of your oral health and your new smile. So thank you all so much for being our guests here on It's a Grand Life. I think if our listeners could visit either one of you, they would have a grand life and get that smile back and give them confidence when they're dealing with their grandkids. And just really appreciate all your time today. And hopefully you'll come back and join us when you have updates on any new procedures or anything new in your practice. We'd love to hear about that. Anything that benefits grandparents, we're all about. So thank you so much for being our guest today.
Thank you for having us.
Thank you for joining us today for It's a Grand Life. It's a Grand Life provides vital content, regulatory updates, and subject matter experts that are committed to supporting the 2.4 million kids and their caregivers from every neighborhood, every city, every tribe and territory nationwide. Please subscribe to our YouTube channel or wherever you get your podcasts and leave a review. Every new subscriber and review helps us reach others that need assistance. As caregivers, we are united in purpose. We are driven by hope while providing strength for today and hope for tomorrow. We are truly making a difference while living the grand life. If you have a suggestion for a future episode, please reach out to us. But we'll see you next time for another It's a Grand Life. Thank you for joining us.